Hi friends, I'm here again. I'm Dr. Punit Jain. I'm a hematologist and a bone marrow transplant physician at Apollo Hospitals, Navi Mumbai. Today I'll be talking on a topic which probably goes undetected for a lot many time before it is actually evaluated. I'm going to talk about anemias. What is anemia? I'm sure you would all know when you get your health checkup done, there is this test that comes, what we call as hemoglobin. A low hemoglobin is what is anemia. Normal hemoglobin is around 12 to 13 in women and around 13 to 14 in men. A hemoglobin, anything lower than that, is anemia. It can be very severe, moderate, or mild. Mild could be around 11 to 10. Less than that is moderate, and less than 8 or 7 is actually a severe anemia. Now, how do these present? Most of them, if it occurs over a period of time, patients will only have complaints of exercise intolerance, easy fatigability, tiredness, and you will start getting a lot of palpitations or little exertion. When you start walking or climbing stairs, you might feel breathless. These are the common symptoms that you would have when anybody has anemias. Now, anemias can be because of several reasons. It could be plain simple iron deficiencies. It could be B12 deficiency, like in a lot of vegetarians. It could be hemolysis, wherein your hemoglobin is getting destroyed in the blood, what we call as peripheral destruction, where your production is good in the bone, but it is getting destroyed in the blood. So it is important to get yourself evaluated periodically and get yourself checked in terms of your nutritional values. What is the iron status? What is the B12 status? What is the overall symptoms? Are you losing too much of weight? There are a lot of conditions or infiltrative disorders of the bone which can present with a damaged cell line effect and a subsequent anemia. So your anemia could be a symptom or a sign, could be a sign of something more grave. It's important to get evaluated. It could be a lymphoma, it could be a blood cancer, or it could be as simple as a mild iron deficiency because of heavy bleeding, like in a woman, in a higher requirement, like in children or in pregnancy. These are all reasons that you can have anemias. Something which is very common in our countries are thalassemia, genetic conditions where actually your hemoglobin is not being produced up to the mark, and it ultimately leads to a mild anemia. You will not realize, but your hemoglobin may never rise above 10. And when you do a test, what we call as hemoglobin electrophoresis, you will be detected as what we call as a beta thalassemia trait, somehow very common in our country. So these are certain things that you should get yourself evaluated. I would recommend at least 6 monthly checkup to a doctor and get yourself checked periodically. Thank you.